I see these little old ladies on Instagram and they're deadlifting crazy heavy weights, and everyone's cheering, but honestly, sometimes they don't have great mobility, and I'm glad that they're lifting heavy weights, but I'm also thinking like, gosh, I so wish for that woman that she had maintained that mobility
Mm-hmm.
decades earlier. It's so,
Mm-hmm.
just like you were saying with muscle, it's so hard to earn and easy to lose. Same with
Mm-hmm.
mobility.
Yeah. Yeah, that's such a great point. And I think that a lot of women, that's a fear. Honestly, if I start lifting, I'm going to lose my flexibility.
Oh,
And we discounted that. I mean, decades ago, that if you're going through full range of motion when you're resistance training, it actually encourages greater range of motion. It doesn't stifle it or shrink it. So it's actually much more helpful. But if you're on the outside looking in, you may still believe some of those things that you learned at a time when you were really impressionable. So, yes, we need that mobility. And I think, alluding to like the really heavy deadlifting, I think there's that fine line where we don't want to cause degeneration by the activity itself. It's not necessarily about lifting as heavy. It's about what are the results you're after? Are you doing this for bone density? Are you doing this for more skeletal muscle mass and for gaining strength? But the strength doesn't have to show up necessarily in just you doing another 45 plate on the weights, because there's no glory necessarily in that unless you're competing. You're probably going to love your life better, the way that you move easier, if you're just paying attention to, how are my daily activities right now? Are they getting easier? Do I have more energy? If I go to work all day, do I now feel like, let's play? I still have plenty of energy at night.
yeah. Or can you pick up your kids or grandkids? Can you get up and down off
Yeah.
the floor readily? That was something very common in my practice. Patients were losing. They would lose the ability to get up and down off the floor readily, and then they would not fight to maintain it or get it back. So an injury
Mm,
would put them in that position, and then they would never
mhm.
come out of the injury because PT, like physical therapy being offered up to folks after orthopedic issues, is abysmal in that it's not offered. It might be in some
Mhm.
places and it might be with some insurance panels,
Mm-mm.
but for the most part, every patient I've ever had to fight to get physical therapy or any kind of rehabilitation
Mhm.
and after any kind of issue. And it was, they just don't get it back. And then it's just one more thing gone. Right. And then there's
Mhm.
another, and then there's just one more thing gone. And I'm like, dude, I want to be able to get up and down off the floor. I want to be able to pick up my grandkids and throw them around if I have them someday. I want to, well, you might be having some grandchildren soon with your son getting married. You better get ready.
I am hoping because, I'm like, I got a little lesson for him. Like, kids break your heart wide open and then they break your heart like 30 million times before they're 30.
Yes.
Like, not that I'm counting, but yeah.
Oh, I know. It's a daily thing. But I also want to be a role model for my daughter, whether she listens to me or not. It's hard to get my daughter to take
Yeah.
exercise seriously, but I know she will at some point because it's in there. I know it's in there. I know, I ingrained it in her at some point where she saw that how much I valued it. And so I'm just trying to lead by example, which is another huge reason I think. And especially
Mhm.
for our grandkids, I think my daughter got to grow up with my parents, which was just such a gift because I did not get to grow up with my grandparents at all. I maybe saw them like
Mm.
once or twice every 5 years, and I didn't know them before they died. And my dad's health has really declined since my daughter was quite small, and she that's the only man she's had in her life, really. And so, because her
Mhm.
dad pretty much skipped out, so she has like that's in her head of how a man ages or something. Do you know what I'm saying? Like
Oh,
she doesn't have a role
yes.
model. So my husband is this really virile, fit, active guy, and I hope that that's something that she can see as like you don't have to choose to age that way. You don't have
Mhm.
to dilapidate. So I
Mhm.
think that we're modeling for everybody as we go through
Mhm.
this life, and we may not even realize it.
Yeah. No, I think that's so true. And I think you're probably touching so many people that you don't even realize what a ripple effect you're having. And I think sometimes with with kids, you don't realize until you hear indirectly, like they said it to somebody else, that they were actually watching. They noticed, and little things start to come out now. And it's like, God, it took this long. Are you kidding me?
Well, we have the data to show that when we're dealing with childhood obesity, we are, 80 some percent of the time dealing with parental obesity in the home. So
Exactly.
it has to go the opposite way as well. Fitness has
Yeah.
got to lead to more fitness, and good health habits have got to lead to good health habits. I mean, this is environmental, it's contagious. You can't, it's not just what you're
Hmm.
feeding your kids, it's how you're choosing to walk your walk and carry
Hmm.
yourself through this life. And so for me, I take that role very seriously. It's not just because I'm online. It's not just a part of it was being a doctor. I cannot stand walking into a doctor's office and seeing a doctor that takes horrendous care of themselves. I immediately walk out. And to be totally honest with you, I've said this out loud before. In the functional medicine community, there's so many of them that don't lift. And I'm like, you literally are just telling me you don't get it, because the benefits of lifting weights are so intimately tied to how our mitochondrial health outcomes are going to be that I can't even process not lifting weights. Like, it's such a non-negotiable. If you actually understand metabolic health,
Wow.
you would lift. And so when doctors aren't walking the talk, I take almost offense to it. Because I grew up a very sick kid being led around by doctors that were in poor health telling me what I should and shouldn't do. And I'm like, you guys can all go F off. 'Cause if you're not walking it, then I'm not listening.
Yeah, so true. That's kind of like you could go back to, I'm from a really small town, right? High school coaches, or we didn't have the greatest role models, for what should this look like? People were talking, but not necessarily walking their talk and demonstrating to you, which is, as we all know, far more powerful.
Yeah, absolutely. I walked into the ER once. I had pneumonia, and I thought I was having a heart attack, but it was actually just I just had a terrible deep walking pneumonia, and it caught up with me. And I remember walking in pretty freaked out. I was with my teenage daughter at the time. And the minute I got into the back room, the ER doctor came in, and he was super fit. He was my age. He was super fit. Like, he filled out his scrubs beautifully. And I verbally said, "Oh, thank God." Like, oh, thank God he lifts, like, thank God he gets it. And he was the coolest doctor I've ever interacted with.